How's it going, Staff 709s? Welcome to Mike 6, evaluating 2 casualties, spinal injury, and shock. Task consists of standards. Task: identify the signs and symptoms of shock. Evaluate and treat a casualty for spinal injury and shock. Mission: you are a member of the platoon within a secure forward operating base in a non-sleeper environment. You are assisting another soldier with an injury to a fellow service member and preparing him/her for evacuation while waiting on medical evacuation. The other soldier states that he/she witnessed the casualty fall from a guard tower. He/she suspects internal bleeding and a spinal injury. He/she goes on to state that after initially acting fine, the injured soldier began complaining of nausea, difficult breathing, and abdominal pain. The injured soldier is lying on a litter with a long spine board when you arrive and is alert to pain only. The uninjured soldier is available to assist you with spinal stabilization and movement of the casualty while you provide treatment. Standard: identify at least 6 signs and symptoms of shock with no incorrect answers within 1 minute. Apply a cervical collar, treat for shock, and prepare for transfer to standard in sequence within 7 minutes without causing further injury. So there will be 2 portions to this station. First portion: identifying 6 of the 12 signs and symptoms of shock within 1 minute. You will have a piece of paper given to you. It will look like this, with 6 lines that you will have 1 minute to jot down 6 signs and symptoms of shock. All right, be legible. We're not checking spelling. If you are a go at that moment, you will move on to the second portion. Apply cervical collar, treat for shock, and prepare for transfer. You will have 7 minutes to complete all steps in sequence. Watch this demonstration.
All right, so for testing, we're going to start off, read task condition standards. If there's no questions, we'll then move on to the testing procedures. All right, we're just going to count you down from 5, 4, 3, 2, 1. Time starts. Your first step is going to be applying the cervical collar. So you're going to come up to the Randy. You're going to remove the M4. The grader is going to state, the other soldier has the head and neck in line and immobilized. This time you can remove the helmet. Then you're going to reassure the casualty. We're not looking for the explanation, we're just looking for the reassurance.
Hey buddy, you're going to be okay.
After that, you're going to measure and determine the size of the collar to apply. You're going to do this 3 fingers in between the jaw and the collarbone. Then you're going to size the collar based on the manufacturer's instructions.
So the way that we size these collars, there are 2 plastic nipples here. Pull them out, slide the arrows outward, and it allows this to free float. You'll then move it down to 3 because it was a 3-finger measurement. Lock them back in, pop the chin guard out, and slide it under the head.
Then you're going to apply the collar to the supine casualty. This step, ensure the other soldier maintains inline stabilization. You don't need to do it because the grader already told you. Then you're going to set the collar in place around the neck and secure the Velcro strap. Once you've secured the Velcro strap, the grader is going to state, the other soldier has the head and neck immobilized. You will then move on to immobilizing the casualty to the spine board using the immobilization blocks, the head strap, and the 2 litter straps.
For these straps, we're not looking that they're incredibly tight because you don't want to cause any pressure down on the abdomen. And these litter straps have a locking mechanism that will lock them in the upward position. Not all of them have it, as you can see here. But if they are locked in the upward position and you need to unlock it, you'll press the fat button, not the little skinny button, and it will unlock and allow it to fall forward.
All right, once the casualty is immobilized to the spine board utilizing the strap, you'll then move on to part 2, which is going to be assessing for shock. The first step is going to be assess the casualty's level of consciousness by conducting AVPU.
Hey buddy, can you hear me?
As soon as we get the sternum rub, the grader is going to state that the casualty does not answer, but he reacts to pain. You can then move to your TCCC card at the bottom section under vitals. You will locate AVPU. You can put a P next to it for pain. Then you can put the time followed by an L for local time zone. Once you've done that, you can look at the Randy and you're going to evaluate the skin. You're basically going to tell the grader you're evaluating the skin.
I'm evaluating the skin.
The grader will then state that the skin is pale and moist and the abdomen is distended. You can then move on to his hand, fingertips, nail facing up. You're just going to squeeze one of the fingertips and release. The grader's going to let you know that the capillary refill takes 4 seconds. You're then going to move into your pulse sequence. There's a lot of medical terms on here. Don't need to worry about it. All you need to focus on is the pulse sequence is foot, groin, wrist, neck.
For checking the pulse on the foot, we're not looking for a pulse check on the sides of the foot. We're looking for it on the top of the foot. So you'll slide your hand down past the laces and feel that pulse on the top of the foot.
Remember, 2 fingers, skin to skin, no thumb. You do not feel a pulse. Moving on to the groin. You do not feel a pulse. The wrist, you do not feel a measurable pulse. Moving on to the neck. You feel a weak but rapid pulse.
I will continue to monitor this for 30 seconds.
Once you prompt the grader that you're waiting for 30 seconds, the grader is then going to prompt you and let you know that 30 seconds is elapsed. They're going to give you a number, 6 to 30. You're going to take that number, you're going to times it by 2, all right? 30 seconds has elapsed, you feel 20 beats. You're going to take that number, times it by 2, and put it underneath the time block in the vital section for pulse rate. The reason we're timing the number by 2 is because you measure vitals in minutes and not 30 seconds. Once you've done your pulse sequence and that's complete, you're going to move on to assessing respiration. You're going to do the look, listen, feel. You don't have to say it. We're going to prompt you that the respirations are rapid but shallow.
I'll continue to monitor respirations for 30 seconds.
Same as the last pulse, all right? It's gonna 30 seconds. The grader's gonna prompt you that 30 seconds has elapsed. Again, I'm gonna give you a number. You feel 30 respirations. You're gonna take that number, you're gonna times it by 2 because we measure in minutes. And you're gonna put it next to respiratory rate in the vital section on the TCCC card. Once you know the soldier is in shock, you then must treat for shock. There's a note. Secure the casualty to the litter before moving. You don't have to worry about it because we've already secured him to the spine board using litter straps. You're then going to look at your grader and you're going to tell him that you're moving him to a shaded area.
I'm moving him to a shaded area.
The grader's going to look back at you and let you know that the casualty is in a shaded area. You can then move on to loosen the clothing at the neck, waist, or anywhere it is binding. This includes the litter straps.
For loosening the clothing or any binding clothing around the body, you don't necessarily have to completely release the flick or the OCP or ACU top, but whenever you're clearing this, you want to make sure you get that kind of deep V in the chest and that anything that was tucked up underneath the C collar is pulled out so that it can be fully exposed. You'll then move down to the waistband. If the belt wasn't already undone from checking the pulse, you'll undo that. Make sure the pants are loose and not restrictive. You'll then check the cuffs in the sleeve and make sure they're loose. Undo your second litter strap. Move down to the pants and make sure that they're loose as well.
Once you've loosened all clothing, you're then going to prevent the casualty from getting chilled or overheated utilizing the space blankets that's provided. What we're looking for here is that you go up to the chin on the C collar and that you tuck both arms and underneath the feet and re-secure him using a litter strap.
During this lane, we're okay with you straddling the casualty as long as you're not putting any pressure down on their body anywhere and causing further injury. And then you're just going to tuck along as you go. Turn around. Make sure that the feet are tucked and then re-strap. Once the casualty is re-strapped, you'll make sure that the space blanket is pulled up almost level with the shoulders or to the chin or the chin guard of the C collar.
All right. Once we've prevented body heat loss, we are then going to calm and reassure the casualty and watch the casualty closely for life-threatening conditions.
Hey buddy, you're gonna be okay. I'm gonna continue to monitor for further life-threatening conditions.
The only thing that needs to be verbatim is life-threatening conditions. You can say watching, assessing, reassessing, anything like that. Now, you're gonna move on to your last performance measure, which is correctly record all treatments on the front and back of the TCCC card.
Alright, TCCC card. The admin data will be filled out for you already. That'll be the battle roster, the name, the last four, the gender, service, unit, and allergies will be filled out for you already. The only thing you have to worry about here is evac status. You'll be urgent. You then move down, put the date. It'll be day, month spelled out, and then year. So example on here is 19NOV20. And then the time. Remember to put L for local. You'll then move down to mechanism of injury. This guy fell off the guard tower, so you'll mark fall. You'll then put an X on his back for spinal injury. If you haven't done it already, you'll fill out the pulse rate, respiratory rate, and APU. All right. Make sure you put the time there also with Lima. And then flip it over to the back. You'll mark urgent again. You'll then go all the way down to other, where it says type. You'll type in C collar, silver collar. In notes, you'll type in signs and symptoms of shock. You'll then fill out your last name, your first name, last four, and then take that TCCC card, tuck it into his shirt or his flick, and that's it, you're done.